And welcome everybody for joining. And wanted to thank you, Roger and Jennifer, for taking the time out today, this hour, which is probably like 2 weeks during a time like this of time in terms of how precious of a commodity it is. And really wanted to thank you for engaging with us. I'm founder of Nyadd, Russell Snaith, New York Alliance for Developmental Disabilities, a grassroots spin-up group that kind of started about 30 days ago in response to, I guess, concerns by the consumer. So we wanted to have a meeting today to engage OPWDD with Nyadd to obtain some answers. And I think that we definitely are aware of the situation out there and a lot of the work that's being done. And we wanted to give you an opportunity to give us an update on what the current focus and priorities of OPWDD are during these times. Our focus, I think, at this point is certainly on the consumer base and all of the people and individuals that your organization supports. And, so we wanted to kind of get some overarching statements and comments from you. And then I think either we've submitted in advance and there's some very specific questions and there's not a long list. So maybe there's a handful or a few of really specific pointed questions that we wanted to get out there, Roger. And I think that these questions probably represent the sum total or the aggregation of let's say the questions or thoughts or concerns that the individuals, the families and the stakeholders have had during the last 2.5 to 3 months during the crisis. And I think that in the beginning we all understood and accepted that everybody from the top down, including OPWDD, did what was absolutely necessary to react and respond to the safety and well-being of our individuals. And now here we are about 2.5, 3 months later. And I guess what we want to talk to you about, in addition to your general comments and update, and we've seen what's been posted on the site and shared through emails from OPWDD going back to March the 24th, May the 20th, et cetera. We wanted to get a little bit more detailed and specific into what that means and some comments around the questions that we have in particular. So again, we're very happy that you're able to engage with us today. And Jennifer, we really appreciate the engagement and the acknowledgement of this group. We definitely want to work with you as a partner. And we're up on the communications. We've been watching the daily briefings by the governor, trying to get some attention focused on this. And we certainly recognize there's some dependencies here with other entities and bodies like the Department of Health, the governor, et cetera. So, going to turn it over to Bob to further frame this a little bit more in terms of the meeting flow and maybe some of the questions specifically that we would like you to answer. So with that, I'm going to pause and turn it over to Bob Carpenter. Bob.
Okay, thanks, Russell. All right, so this is going to be, my part of this at the beginning will be pretty brief. Russ did a great job in outlining what our mission for this particular meeting is, and I would just like to kind of share a little bit about what the structure will be like. So after this, I will be passing this on to the Executive Deputy Commissioner of OPWDD, Roger Bearden, who will be discussing as Russ said, sort of an overarching explanation of the current health crisis for us and the status for moving forward as we unpause New York. That then will be followed by a few 4 or 5 pointed questions that we've put together from input from our membership, our now over 2,600 membership at Nyadd and growing every day. We're going to be hitting 3,000 pretty soon. Very many concerned parents and family members of people in this special needs and developmentally disabled community. So after that, if we have time permitting, we will probably look to open up the mic to a couple of our members for some further comments on some specific things that may not have been directly addressed during all of this. So without further ado, I will pass the microphone to Executive Deputy Commissioner Roger Bearden. Thank you.
So first of all, thank you very, very much. I do appreciate any opportunity we have to communicate, to try to describe the best, best thinking we have at the moment, which may not be the best thinking that we should have at some subsequent moment. And I'm a very big believer in trying to do public policy, trying to serve the people. That the engagement that we can, as much as we can engage the best with the constraints, obviously, that I think were identified at the outset of how much time there is in the day and how many things there are to do. So I wanted to kind of go backwards for just a quick second to sort of the thinking that was present back in kind of early to mid-March when we made some of the decisions that, now we are, trying to figure out how do we carefully reverse, if you will. So the first component was when we were confronted with the crisis, and this is in early March when it was, I think, March 11th that we had the first known infection to us in the DD community. In some way, we were very cautious in the way that we approached the closure, particularly of day programs. And for scope and scale, it's about 55,000 people across the state who are beneficiaries of those site-based day programming. So we were very concerned because we knew exactly what kind of impact it would have on families and on individuals. And, sort of the best public health information that we had available to us told us that was a priority. And actually, I want to backstep. I wanted just to make sure that folks know who I am. Executive Deputy Commissioner is meaningful to those of us in state service, but may not be a meaningful title. I'm the Chief Operating Officer of OPWDD. So above me is the Commissioner who gives the overall direction, and then the operations of the agency fall under my direction. And prior to that, I was actually the chief lawyer to the agency, as well as some other roles I've played in the Cuomo administration. So when we were looking at the closure of day programming, the suspension of visitation, and then the return to home policy, which in the relationship between folks who may wish to bring their loved ones back into a family home and in preference to the group home, we understood and were very cautious in the impact that would have on families. The strategy as the state has moved forward in combating this crisis has been one of intense collaboration. OPWDD does not, make public health decisions independent of the overall public health strategy of the state. And I would go so far as to say that you wouldn't want us to, right? We don't want every state agency, every sector making independent decisions that may be self-contradictory. So the issue is, how do you achieve that coordination? How do you act in real time? And then how do you make sure that you're communicating? Everybody hearing me?
Yes. Very
okay.
Good, Roger.
Somebody put in the chat room, I am not hearing anything. So I wanted to make sure that was on the user side, not on the, because I thought I was being quite eloquent, but if nobody could hear me, then then we could go. Okay, so we're trying to balance, in essence, a coordination strategy, which in the best of times, there are dozens and dozens of state agencies. There are hundreds and hundreds of sectors that are out there that in some way touch the state's regulatory or financing structures, liquor stores to hair salons to DD facilities to whatnot, right? And how do you make sure all those things are coordinated into a single public health strategy? How do you make decisions in real time? And how do you communicate what you're doing? Because the mantra, and I think many of us have become much better public health experts than we might have been 12 or 13 weeks ago. But that was not a primary business function for OPWD, epidemiology and public health, in early March. It was something we knew about, but not. So we're trying, and so in, I think in the initial phase, we have a process of closure, which in some ways was easier than the process of reopening. And what we're trying to do now is figure out how can we potentially pilot a visitation program? How can we look at the gradual reopening of day programming? And what does day programming look like in that context? And then how do we manage the return to home protocols so that folks who have been brought home with for safety and security in the midst of the crisis can safely return to the group home without in turn creating threats to other individuals who may be present in the home. And that's related then to the availability of tracing, contact tracing, and testing capacity to be able to run down. So that's the balance we're trying to strike. And I know there are many, many individuals. We see the onslaught of letters. I know I've seen letters from your group as well as individual members and collectively. I'm certainly more than well aware of a lot of the press that has been paid to this. On the other hand, I do actually see a lot of letters and complaints about parents who are cautioning us not to go too quickly. There is a piece, and so we're trying to achieve that balance. That is the balance we are working with our partners on. I'm giving you the accurate description of where we are at 1:14 p.m. today. I have no illusions that that's a fully satisfying answer, but it does have, I guess, the merit of being accurate at this moment. And I'm hopeful that we'll be able to roll out soon kind of a pilot program around visitation. But we haven't been able to quite get that all coordinated just yet. So let me pause there. And I see there's a lot of notes coming through in the chat. I know Russell the other gentleman, you were positing yourselves as moderator. I didn't want to take the time by speechifying, but I wanted to frame sort of how we're thinking about the problem right now. And let me pivot back over to you to see where you want to take the conversation.
Yes, thank you. Yes, and a lot of these, I do see some comments also showing up in the chat, and those are, for the most part, much of the questions or some of the questions that we will be asking today. So yeah, the first question, I'm just going to go ahead and read this, and it's probably easier to do that than try to remember from memory what I wanted to say. So this might sound a little bit, like I'm reading, because I am. So the first question: with virtually everything imaginable opening up, with safety guidelines in place, including things like public pools, barbershops, tattoo parlors, and brunch at your waterside bistros, how is it possible that after all this time, OPWDD hasn't been able to work with the Department of Health and Governor Cuomo to have a plan ready now for the safe and reason and responsible reopening of both in-home and weekend visits for group homes and day habs? I also want to just add one quick note to that. Speaking to today's press conference from Governor Cuomo, one of the first questions he was asked was about the visitation to group homes and nursing homes. And unfortunately, we kind of got lumped in there with nursing homes. And we need to make it very clear that they are very different. I mean, there have been many things that have been accommodated to nursing homes, like PPE and testing and so on, that have not been made available to our group homes, and that's something that we need to address. But also, these people are very much different from Governor Cuomo's mother, for example, as he pointed out. For the most part, and you can correct me where I might be slightly wrong on this, the people in nursing homes are, for the most part, getting all the services and things that they need. The one component of that might be missing is the visitation of their family members. And for the most part, just like Governor Cuomo, most people understand that and are willing to accept that. These kids and these young adults are in a very, very different category. These are kids that there's just so many, difficulties, frustrations, anxieties, behaviors getting escalated, self-injurious behaviors, and so on. That these things, they just they're not capable of understanding what's happening. Unlike many or most of the people in the nursing homes and their families. So with that said, sort of an editorial comment. I'd like you to answer that first question.
Sure, and I'm seeing many comments flowing through the through the chat room, and I'm trying to kind of read them and assimilate them at the same time. And just so folks are aware, we've got a couple people from OPWDD who are also on this call and are going to be able to take some notes in terms of there are some specific questions that I'm seeing here, and to the degree to which you all can catalog them as well. Where I can see questions that are more of a that maybe are more of a micro question, I guess I would call it. I think one of the challenges is, I guess, what you're saying, Bob, and what others are saying, right, is, these are not nursing homes. And I think that's understood. I think that our agency has a deep understanding of the individuals we serve. But there has also been, unfortunately, a disproportionate to the overall population impact on people with DD living in group homes. And we have been making public on a regular basis, the numbers of individuals impacted, both from an infection perspective and from, unfortunately, those who have passed as a result of the virus. And that is gives us some pause, gives us some caution, and then you look at the data, the overwhelming impact in the IDD population has been in, and I'll just use the generic term, group home, to encompass our various, regulatory flavors.
Yes.
On the other hand, we have also seen that the impact in terms of death has been primarily, though not exclusively, on individuals who have identified pre-existing conditions consistent with the overall.
If I can interrupt for just a moment, I'd like to point out, though, that I do agree. We've all seen the stats. We've had these posts on our group, and we've seen it in others. But that just begs the question: where, if this community is, and we don't disagree, they are a vulnerable community. Why is it then that the PPE and the testing hasn't been made available to this group, for this population, for the staff, and for the people that are so greatly affected by this? Where has that been? The nursing homes got theirs when the news brought this to Governor Cuomo. He immediately made those steps to make the executive order to make those things available. And why hasn't that been done for this community? And why hasn't OPWDD stepped up to the governor and demanded that?
Yeah, I guess just to add to that, Bob, what is the metric or the linchpin, Roger, to allow visitation when staff are coming and going? So we do not have a closed circuit when it comes to protection and quarantine. There's never been a true quarantine, ever. As long as staff are coming and going, some have two jobs, they have families that go into the community. So if you have one missing link in a chain, you don't have a chain, you don't have a closed circuit. So, I think that has to be considered. And then what is the metric or fact or linchpin that gets us to the point where we can say that it's safe to resume visits and put any kind of plans in place that you may be working on to allow visitation in a home, to allow a home leave, or to resume day habs? Back to you, Roger. Thanks.
Right. So there's about 4 or 5 things in there. So let me if I miss one of them, don't come back to it. It's not intentional. It's my poor memory or poor note taking.
No, that was a lot.
I think so. So I want to start with PPE, because I think that's an area where we have had as best as I understand it, and you know, there's always a challenge, right? With the limits of one's understanding is early in the crisis, we really did have a struggle in the group homes to have a sufficient PPE. Nobody kind of was ready for this from a PPE perspective. It was, and there were some very significant efforts in early, and I'm talking in the first couple of weeks of March and into the third week of March to secure and procure, and I'd say efforts by OPWD, efforts by the governor's office, and the statewide distribution, as well as, and I have to give all the due credit in the world to our nonprofit provider community, some of whom really worked their procurement very, very well, and were able to get a lot of PPE. What we set up in conjunction with the providers was a sort of an exceptions or reporting process, which is to say, we originally set up something where we were asking them to report to us about the amount of PPE on hand. And they felt that was a little onerous, that they had better things to do in essence than give us report outs on that. Which I'm not meaning to be dismissive. I can understand, you know, you're facing a crisis. There's only so many things that you want to do in a day. And they suggested to us, and we accepted the suggestion, that instead we would ask the question of them as part of the reporting structure we put in place around COVID-19, are there any shortages of PPE? Do you have any needs? And that we would thereby kind of lessen the regulatory burden on the providers. And I will say that there were a few instances, once again, this goes into late March, early April, where we were made aware of some critical shortages, and we were able to help assist with the deployment. There's a state stockpile in essence. And in one case, I remember we put it on a couple of vans and drove it down on a Saturday to a provider. Since that time, we really haven't had any concerns. The only PPE issue was with the self-direction community and making sure that the FIs understood the responsibility as the employer record for the self-directed employees. So that's the PPE. Testing, what we've been working on is, first of all, there is a prioritization of individuals for testing, and you know, the primary focus of the governor has been and I forget the number of testing sites that there are around. What we've been working on is in places where that's not a feasible strategy, in the sense of an individual may not tolerate a transport in some way, how to find that opportunity for them to get tested. And what we've also been actually just working on in the last several weeks, and I'll say that there's been a huge pushback from some of our provider community on this. So, nothing you do gets universal approval. We redeployed we had suspended our survey activities, our routine survey activity from our quality assurance inspectors, and have now deployed them really to be looking at those homes where we have more concerns, and we're building on that now, where we track on a daily basis wherever we see a new infection appearing in a home, and we then are going to be leveraging our surveyors to immediately follow up on that, either virtually through phone calls or in person if necessary, and making sure that appearance of a new infection is followed up with appropriate testing, and also, more equally importantly, right infection control practices. So I wanted to kind of hit each of those points. Did I miss anything, Russell? Somehow in my Zoom, all I see is Russell, and I don't know how to change that in the way I'm looking at it, but so I get to see a lot of you.
That's fine, Roger. Well stated. We appreciate that response. Allow me 1 second, some latitude, just to add to this. So how far away do you think we are from seeing or hearing about a plan from OPWDD with some dates for even the initiation or start of an initial pilot for visitation, home leaves, and day habs? Like, hey, day habs, we're shooting for August 1st or September 5th. first in some region? Like, how far are we away from like some real dates and plans that we can kind of go away with and say, you know what, I have some confidence and comfort that we're just not working on it, but that we actually are moving the ball down the field?
Yeah, no, it's a very fair question. I had said into a different stakeholder group, and I said that a week ago, and I hope that did not happen in the time frame I expected. I would like to be able to give you a firm date, but I do not have a firm date at this moment. Certainly, I'm more than well aware of the governor being asked the question at today's press conference, and I'm certainly anticipating further discussions as a consequence of that. But I do not have a firm date, other than, we have a plan that we think is implementable, but we just need to make sure that, all of the constituencies that we deal with are fully comfortable with the plan.
But if I may, all of us have seen the statements from OPWDD, and many of us have been on the various news sources. I mean, our media coverage list is in the teens at this point over just the last couple of weeks, and in every one of those reports, the statement that these news reporters go out and get from OPWDD is the same exact canned statement, possibly reworded slightly, talking about, and I quote, phased-in approach to the resumption of programs and visitations, which we hope will begin rolling out soon. That soon word is the real the got you, because it means a lot to me personally too, because I'm a little bit different than a lot of this population, where we went and we got my son and we brought him home because we tried these virtual visits. That was out of the question. We tried the PPE with gloves and distancing, visit that was allowed by our agency, and that didn't work. And my son is slightly verbal, and he kept saying, "Mommy, Daddy, home. Mommy, Daddy, home." And all we could do week after week would just say soon, soon. And that word, it means nothing to them, and it's really not very helpful to us either. And we just need to get some answers. Why aren't these plans at least being shared with us for input? I mean, and we've also been told from our agencies and from whoever else we reach out to that these agencies aren't even allowed to give the input. We're just waiting for guidance from them. We're waiting for instruction and direction from OPWDD, and it's not coming. It's not going down. It's just they're not taking their input, and they're certainly not taking our input as well. None of that information is being shared. So we really need to try to get some information. What we really want is answers. A time frame would be great. We'd love a date, but at least share some of those things with us. Maybe that we can have some input in the process.
Right, and I fully understand the frustration. I'm seeing it in the chat room as well, and I very much want to be able to give you a firm date. I that would be my greatest desire, but I don't want to give you a firm date that I don't have, and that is, I think, a worse answer, making a promise that I can't deliver on, than to tell you the honest answer. I do want to address, it looks like day habilitation. I want to give you a little sense of what we're thinking about, or day services, because it was mentioned a couple of times, and I see it's going through the chat room. Does that make sense to you, Bob?
Sure, go ahead, by all means.
Yeah. Okay, so what we're looking at there is really three things, and this is something we've been talking about. Initially, we had a discussion with some provider community the other day, and we've been trying to have this discussion with various communities in this week and into next. One item is we would working on a guidance document, which would be how to operate site-based day programming in a way consistent with COVID-19 and the universe we're living in. And we are I don't think there's going to be anything that's going to be seen as terribly, original in that document, in the sense of, the proper infection control measures, the size of groups, cohorting. We have a really significant challenge when it comes to transportation. I think, as many know, that particularly for the people residing at a family home, there may be a school bus that may be picking up many individuals and bringing them to a single site. So, what we're engaged with our providers of that day habilitation or day services, because there's also day treatment, is to help them start to think about alternatives that they may be able to offer families, understanding that, the likelihood of continuing the programs in exactly the way that we have had previously, and is an unlikely scenario. And so, what are the alternatives? How can families be engaged with providers of the day services, as well as their CCOs, to maybe start exploring other options, because we are going to not be able to go back to day hab as it's been known previously. We're also looking at continuing for at least a number of months, maybe more. And that's an interesting question as to what the right thing to do is the ComHab-R, which would be the ability to deliver day services through the residential provider. And that doesn't necessarily mean in the residence when we're able to relax those restrictions, but would be continued by, and would expand the capacity, which would lessen the number of individuals that would be coming into a single day site at once. So that's the structure of what we're thinking around there. We've started the engagement process, both with the provider community, with the CCO community, which obviously needs to be able to provide the care management services to individuals so that they can explore what their options might be, as well as families and individuals, self-advocates and parental advocates, to try to begin that thinking process.
So if I can jump in there for a moment, I think I heard something in that about a document. So is that something that will be released as sort of a work in progress plan, or a document that will be distributed? And also, I don't think you answered that one question about the input, if any, that you're accepting or welcoming from the agencies for how to do these things. Because these are the people, and including and I'll add us as the parents and family, we're the ones that know what their needs are the best. I mean, I think that you would probably agree. The further up you go, the further detached you are. For example, that Governor Cuomo makes it pretty obvious that he's very unfamiliar with our community. He had a hard time pronouncing OPWDD a couple of weeks ago in one of his press conferences. So, it's pretty clear that, we need to get some input from the bottom up as well as from the top down.
I agree. And your group, I think, was new to me, which wasn't, I guess it's a new group. So if you have, certainly I can take away from this conversation the very obvious frontline point that you are pressing around visitation. I loud and clear, understood, got it, and that needs no greater clarification.
Okay. If I can though, just really quickly, if I can clarify it even just a little bit more, I wanted to make it clear that if the plan involves, things like the virtual visits, like FaceTime and things like that, and the PPE through the window type visits, that's just out of the question. We need to work on the safe way of having, in-person visits, and the whole list as we've already been, described.
Yeah, absolutely. No, the idea would be, how does one do what's the opposite of a virtual visit? An actual visit.
Real.
So I think that's real. Thank you. But the question then is, how do you do that in a way that maximizes safety and avoids the recurrence of hot spots of infection? How do you do it in a way that in the event that there are reinfections, we're able to quickly kind of attack that through effective contact tracing and testing. So that's and there are a number of virtual visitations that are already permitted. So that's not what we're talking about.
Roger,
we're talking about it real.
If I could just jump in to clarify for a second. So I think in the scheme of the prioritization, the short-term home leaves and I guess the physical on-site visits that are not through a window or a backyard, some of those may not work because of behaviors and different dynamics or expectations of the individual. Some are fine with Zoom. Some are fine with no visits. Some are fine through a window. Some are fine 6 feet away. But a lot of them are used to the parent going in the bedroom or into the house, tucking them in, reading a book, and taking them home for the weekend. So I think the thing that I'd like you to think about, Roger, and take away is, so your interest is in protecting the public health. And I understand that. And first and foremost, physical and medical safety. But as time goes on and we get to a point in this, that the mental toll and effect of the behaviors and the medicine changes and the stress and anxieties starts to overweigh, right? So there's this trade-off here. There's a risk management decision that you're making between physical safety and what is that risk, where a lot of them might be asymptomatic carriers or already had it, versus the mental risk of the effects on these individuals and their families that may or may not ever go away. Are you guys talking about in the high level meetings there about that trade-off?
I'm sorry. You said the last piece, there was a huge interference probably because I was trying to respond. And the last thing you said, the last 3 sentences, I absolutely missed. So could you just repeat them? I'm sorry.
Yeah, just the whether the consideration of the trade-off between the aim to protect people physically from the virus versus the mental toll that starts adding up. The more time that goes on, there's kind of like a chart, right? The more time that goes on here, the physical part of it may stay the same or change, but the mental toll and the risk of mental damage to people through medicine changes, anxieties, SIBs increases over time. So, and I'm not sure if it's linear, Roger, or if it's like, more of a very steep curve, but that's what we're thinking about as parents, is that in the beginning, you had to protect the physical safety, but now everybody's gone out. A lot of people have been asymptomatic and been exposed to this. But so now maybe the mental toll of the lack of visitation for 90 days or the inability for them to come home is starting to overshadow the physical risk. Does that make sense?
It does. It does make the trade-off or the between sort of mental and physical safety and the mental health of the individuals and of the family members as well, right? I mean, that's a consideration, not equally necessarily, but also a consideration. We are very well aware of the balance. The balance is one that we engage with there on several times a day with our partners in government in trying to think that through, and informed by the data around where are there new infections, what is the success or lack of success in terms of combating COVID in various sectors, and in an effort to work and have things that are similar move at a similar pace. It comes back to that, that balancing question, I think is a fair one, Russell. And it is exactly the question we are trying to answer along with our, with our partners.
Soon,
I saw in the
right?
school.
Is that soon word gonna come back into the conversation?
I mean, I can give you a date, but then you can say, well, you gave us a date, and
that's all we want.
That's yeah.
Okay.
Can I just ask? Are there other? I noticed in the chat room a repeated question about residential schools, and I just want to make clear that the decision making around schools is really coming through the educational system, not through OPWDD.
I do have. That's one of our questions coming up as well, and I think we may as well go ahead and move on to that. I think we've asked and you've answered that question. Is what we want and what we're requesting, and I think we have at least where your stance is. We are looking for specific information to be shared. More adequately with us as these things are available. But let's go ahead and move on. My second question was kind of already asked and answered. It had a lot to do with the PPE and testing, and I think that more or less has been covered. So we'll skip to my third question, and it has to do with the school. So I'll go ahead and read it as I wrote it, and we'll see how that. You can answer that and maybe make some clarification on this for us. So with regards to Governor Cuomo's executive order, it was number 20237 this past Friday, allowing for in-person special education this summer. How does this affect the special ed schools run by OPWDD, if it does? And how is OPWDD helping the agencies under their control prepare for that? And if they are those facilities going to be ready in time for that?
Well, so I think there's a factual premise in that question, which I'm not sure is correct. We don't as OPWDD actually oops, sorry, I just lost your video. We don't oversee the educational component of the schools. Our role has to do with the residential, the group home equivalent of the CRP or 53. So the decision making around opening the school component, which is, I believe, the subject of that executive order, whether kids can go to school in that context, lies with the education department and with so that's not a decision that I either made or didn't make. It's not within our portfolio.
I understand, and that is kind of my understanding of it as well. I did want to give you the opportunity because we've had a number of members in our group posting the fact that no, we need to still stay on OPWDD for some of these things, and I just wanted you to have the opportunity to make that clear that this really isn't that part of this really isn't an OPWDD thing. So I think you made that clear. So I'm going to then move on to the next question, and this is another sort of ask, if I may, on some clarification of another executive order, and this has to do with the executive order. Well, again, I will read it the way I have it written, so I don't confuse it. There has been a lot of confusion over the governor's executive order, originally set to expire June 6th and then extended to July 6th. It was the Executive Order 202.5, which, among other things, discusses the restriction of visitors in certain mental health facilities. Can you clarify if and how that relates to the reopening of family visitation within group homes? Does that executive order fit what we're asking for to be opened up?
Yeah, and I'm always cautious, although I previously served as the counsel to the agency. Fully answering a legal question without my counsel who actually reviewed those orders. My understanding of that executive order is that it permits the suspension of visitation where so visitation would otherwise be permitted. It would give authority to agencies that otherwise might not have that authority to restrict visitation. So it is the underpinning of our ability to say no visitation. And it doesn't say, though, however, that we must suspend visitation. It gives us the ability to do so. So in the example of, without giving a date, but let me just say, someday before it's I think you said June 6th twice, but I think it actually extended to July 6th. I think it was a 30-day extension. That, in the event that we were to say, hey, listen, we're going to do a pilot, we're going to do a phased in visitation, in a date that's before July 6th. And certainly that's our hope, that's our intention, but I don't have a specific date. Then that executive order would not require us to wait until July 6th. But let's suppose we're continuing to restrict visitation in some way, but not in the same way that we have up till now. That executive order would continue to give us the authority to have restrictions in place. That's my understanding of the purpose of the executive order. I'm gonna see whether I'll check with my counsel after the call to see whether I stated anything that's that's inaccurate, and certainly seek to correct the record there. But I think that's the basic idea. It's the underpinnings of it. Does that make sense to you, Bob?
It does. Yes, I appreciate that. So I'm just looking through my questions, and I think that the remaining question was somewhat covered in our previous, discussions about some other questions. But really, it was, and I think you got the sort of the shorter version of these questions in the email earlier. And really, it was just really kind of boiling down to that whole, there's no new statement, no new information out of OPWDD from that early March statement, and then it's a slightly edited version a little later on about this whole phased-in approach. And so, the real question was, again, it was sort of a three-part question. When is soon? Soon isn't really working anymore. There's no details about this phased-in approach. And then the last part of it was about the input. And I don't think that you answered that yet, so I'm going to ask it again about the input. What input are you encouraging or allowing to come from the agencies and the parents? Because that's one question I don't think was quite covered.
Yeah, well, so I'll answer that kind of in two pieces, and because it depends upon which topic we're talking about. So early on in the crisis in March, we met, and your group at the time did not exist, so you were not part of our communication strategy.
Well, as you know, we just started our group less than 4 weeks ago, and our membership has grown.
Yeah, you have got a logarithmic growth in your group membership. So what we were doing at the time with a variety of stakeholder groups is we had a daily call every day at 4:00, 7 days a week. This is what we're thinking. This is what we're working on. This is where we need your input. And do you think our thoughts are, back then it was, should we close Ahab? Should we suspend visitation? And it's an area, and into April, we were meeting again every single day. As the crisis has, I would say, stabilized, we moved into a mode where we were meeting 3 times a week. We've now actually titrated that down to 1 time a week. And we've tried to work with a cross coalition of providers, of care management agencies, self-advocates, family advocates, et cetera. And in a service system that's as broad as ours, we touch 140,000 people's lives. It's impossible to have a consultation process that is fully, touches each person and also to be able to move in speed. So we've done our best. We've been talking constantly on the visitation component. I think that the aspects of what we would be looking at, if you look at, for example, what's been articulated with the hospital visitation, policy, right? You can see the major components of a safe visitation policy. Certainly, if this group or any other group has, ideas that you think, ought to be considered, certainly one of the pieces of feedback was not virtual. I think you said real, and we understand that. The questions then become things like, should there be a visit if somebody has a roommate? right? Where should that visit take place? Should a visit take place in the bedroom, knowing that parent one may risk, infecting their own individual, but the second individual, that's somebody else's loved one. So it's those kind of practical operational considerations that certainly if there's any, there's no mystery here to the kinds of things we're trying to deal with. PPE, obviously the more folks are masked in any public setting, the better, right? Or private or semi-private setting. So should family members who are visiting in a visitation pilot or visitation relaxation have a mask on? One would think, yes. What about temperature screening? What about logs? So that in the event, I know that, in the event that there's an infection that may be attributed to the visitation, that you'd be able to quickly contact trace, because it wouldn't necessarily be the case that we would have, immediate contact information for the people who have visited. It's those kinds of considerations which in our sort of new normal should be of absolutely no surprise to anyone. In terms of day services, where it's, I think, a little more complicated, we are actively working on, just this morning, we're working on a stakeholder outreach strategy, having kind of set out the outline of what we're trying to do. And I'll tell you, the providers, when we spoke to them, they were saying, they weren't too anxious to start a lot of site-based day hab right away. They were very, they're cautious, and we have to deal with that. That's a reality of restarting programs, that you're dealing with actors, people who are running day visitation or day treatment programs, Prevoke, that may be more cautious. Even if we say it's permissible, they may not want to do it in the way that we say is permissible. So we're going to be trying to do some reach out to say, what are some things, features, for example, ComHab-R is a feature that is present for individuals who live in residence, where they're able to get some day services during the day. How's that? Is that a good service? One that we ought to make a more permanent feature of the OPWD menu of services, or is that something that was good enough for the emergency, but we should let it, go away? I think they're both available opinions, and so we definitely want to know more about that. So I guess it depends on the topic, and so I guess I would kind of pivot the question back to you and say, as your group have, obviously the broad-based question of, visitation ought to occur. Got it, right? But if there are specifics about what you would like to see visitation involve, how you think it should transpire, we're all ears, and so that would be very, very helpful to us.
Well, yeah, Roger, definitely happy to collate that input, from the group and give you kind of a single-threaded, response on that. The one thing we see too is with the ESY and in-person school being sanctioned for the summer, and camps and things like that. So the hesitation of providers, OPWDD or Department of Health to resume these day hab programs is kind of illogical, because there's several conflicts there with that logic and thinking. So I'd like you to consider that, because you can hold on pause or be in a holding pattern forever with this population and say, well, we don't know how to handle it. There's a lot of moving parts. There's a lot of risk. But I guess I'd like you to think about, or maybe respond to, so what are the key things you need to solve for that are not in OPWDD's hands? If you need a green light from the Department of Health, we can knock on that door. If we need the governor to step in, we've been knocking on that door. But are there any things that are not within OPWDD's hands in terms of tools, resources, or information to be able to solve for this and expedite these plans?
I don't think there is a lack of information. I think it is a consideration of all the factors that need to be made by a number of our internal stakeholders. So certainly there's been a lot of advocacy. We've heard it, we've seen it. Everybody has seen it. As you alluded to, the governor heard it today at the press conference. So this is front and center, and I would say if you have specific recommendations, we'd love to hear them. If you want to keep pushing us, that is your job. My job is to try to be as responsive as I can and give you as accurate as information as I can at the moment that I have it. I can see that there are lots of folks in the chat room who are not pleased, and we get it. We understand. We have heard it loud and clear, and we are doing everything we can to advance this through the process that we must go through in order to, I would say, get the relief that you are looking for, get the progress that you're looking for. And I had hoped against hope, apparently, that I would be able to come to this discussion and say, look, we heard you, and we have a date, and my real hope was the date would have been yesterday. So the tenor of this conversation could have been different. And it is not my style to avoid a hard conversation either and say, well, wait a minute, I don't have the answer. Let me just, deflect and pretend that it's not a real issue. And so that is the effort that I am undertaking here.
Roger, I know we're running out of time, and I want to get back to Bob, maybe for some last minute questions from some of the folks. But I want to just say how, I appreciate you taking the time to be here with us. It's not an easy spot to be in. 3,000 people in a group here, 100 of them on the phone or the WebEx right now, the Zoom. And I appreciate you just shouldering the questions. And we didn't get the answers we wanted, and you don't have the ones you want to give us. But I think you've framed the prioritization and how important it is to us. So thank you. With that, I'm going to turn it back to Bob.
Yes. Yes. Thank you, Roger. And I'll come back after this. We do want to ask one, we are running short on time. So I do want to ask, there's one member that I'd like to have speak. Her name is Pam Frank, and she has some comments that or questions that she'd like to pose to you. And then after she's done, I just have a little bit of a closing thing that I'd like to say as well. So go ahead, Pam.
Hi, Roger. So something that's very scary to me that you mentioned, you talked about DayHabs and changing it to ComHab-R. And then you went on to say that could be a permanent change. I think that is some of the problems that parents have. This was a crisis. It was a pandemic. We understand things had to be done in an emergency situation. But as you decide how to unroll DayHabs to reopen, to say that you're going to make permanent decisions based on a pandemic, I mean, that hopefully this will not go on forever. And we will have vaccines, and we will have to turn around and just say, oh, we're going to pull DayHabs and make them DayHab-R or ComHab-R without even have open discussions with agencies and parents is very, very scary to us. Things that have to be put in place right now to get us through the pandemic is one thing, but to change the years of DayHab planning based on this is very scary. And secondly, just to go back to your opening remarks, you had said about OPWDD, all of us have learned tremendous amount about healthcare and medication, and we never had to make these decisions before. So the question is, why isn't OPWDD then following the guidance of the rest of the country? Here in New York, we have phases. We're all in different regions. You are dealing with a system from all the different regions of New York. Why aren't our group homes and DayHabs tied in with the regional plan? Why? We can never go back. The loss of life that we experienced in the DD community is terrible. Similar to the nursing homes, yes. But you cannot correct that by just being now overly cautious. We lost those people at the height of the virus due to all of us, not anybody's fault, not OPWDD's fault, losing people because we did not have PPE wear. We did not know to isolate. We did not know people are sick. Now we know all these things. We know how to test. We know how to isolate. We know how to wear PPE wear. And as the regions unfold and everything opens, tattoo parlors, hair salons, beaches, and now our staff is not in lockdown, and our staff can bring all this back, to only exclude parents as the people who will make our individuals sick is not fair. It is time now, unfortunately. We can't redo the losses we've had. We can't stay closed we will never gain that back. Parents cannot go on without seeing their children, without having home visits. We have to follow the state plans. If it's good enough for the states, if barbershops and beaches and beauty salons can open, we need to have our children back. Why are parents not able to keep their children safe when a tattoo artist can keep me safe? Or a beautician can keep me safe? I know how to keep my child safe. I haven't left my home in 12 weeks. It's time I'm allowed to bring my child home.
Thank you, Pam.
Are there any, is there a response? I don't want to see day have R be the new way of life. I don't want to not see my child.
I can address that piece of it. I mean, I didn't want to go back to that piece because so much of what you said right there was not about that, and I wanted to make sure that those points were understood. And I do understand what you're saying about the other piece. And I don't want to make sure that my comments were not misunderstood in terms of the ComHab-R. We have, I think, several phases in responding to this from a program standpoint. We have this thing called an Appendix K, which is the federal authorization which allowed us to make some changes in how we administer our services. So if we normally have the waiver that defines the terms. And the Appendix K is good under its current terms till September 7th, 6 months, from the beginning of the declared emergency. And then we have a decision point. Do we continue the Appendix K as it was for another 6 months? Do we make some changes, or do we allow it to expire? The maximum amount of time the Appendix K can be in effect is 1 year. So March 8th of next year. So between now and, I don't exactly know when we have to submit the next Appendix K, it might be mid-August, so but it's sometime before September 7th. We need to have a dialogue. What's working in the current Appendix K? What isn't? If everything's working, fine, we'll keep going. ComHab-R, it doesn't exist in our normal waiver. It exists under the Appendix K. So I'm asking, hey, has this been a good thing? Has it been a terrible thing? Or are there mixed views somewhere in between? Just focusing on that. Should we continue it for another 6 months? If we say it was a really great thing for 6 months, and when is another 6 months? I don't think any of us can reasonably predict, I certainly can, when is there going to be a vaccine? When is this nightmare going to be over? So at 12 months, are we still in an emergency? Does the federal government say you can have more Appendix K? You can have another 6 months of Appendix K. Are we fully beyond this? I don't know anybody who has an answer to that question. But I need to understand, are the services that we did on an emergent basis to respond to a crisis, are they positives? Are they negatives? Are there somewhere? I have heard from some families, particularly those with, elders, individuals who are older, have aged in a group home, and maybe grew tired of the routine of going to a day hab from a group home. The retirement cohort is how people have referred to them. That they may want to have something like ComHab-R so they can retire, and that may be the people for whom that should become a permanent capacity in our service system, or not. Maybe it's a terrible idea. I don't know. I just know that it's a new thing to us, and so it should be looked at. Our stakeholders should give us feedback, and we should make a decision about it. So that's what I was trying to say, is that we have these phases in terms of our ability to have Medicaid-funded services, and to the degree to which we need different models during the day that are not ComHab-R. You need something else that would help people achieve meaningful activities during the day, different from or in addition to a site-based day programming that they've become accustomed to. What are those things, and how might they help people? And then how would we get the federal government, of course, to allow us to do that and to participate with federal financial participation?
I think that's what I think that's the point that Pam was trying to make. That is that we should not consider an outright replacement of our existing day hab program for this as an extra option for certain people, as you pointed out. The elder population that may like that sort of thing or benefit from that would be fine. But that certainly is not something that would be thought of as a good thing for replacing existing day hab. So I think we're gonna leave it there. I do want to just say this, and I'm gonna let you have sort of the last comment or words on this for this meeting, and I'll just ask this. The one fear that I have out of this, now we have pretty much, we hit the max of occupants for this meeting at 100 for much of the last hour and change. The one thing I fear is that a lot of these people that have spent the time to come in and spend all the time in the past few weeks doing everything that we've been doing to try to get the attention, and now we have it. I'd like you to address, if possible, a takeaway that we can have, maybe something new that you can share with us that hasn't yet come out in this meeting, something that you can leave us with to give us some hope, and also possibly, as Russ said earlier, some guidance as to how we can help you in the mission to get back on track and get everything reopened again. So if you can go ahead and touch on that, and then after that, I think we're just going to go ahead and say our goodbyes for now and look for the next opportunity to speak. So go ahead, please.
Well, thank you for that, and I do really appreciate the opportunity to meet with you all. It is always better to have an opportunity to engage with folks than to see letters, and all of those are important. I guess the first point I would say is at OPWDD, and this may not be communicated well, and I understand that the message, certainly looking at the chat box, is not being received. Our goals are, at the heart of it, to make people's lives richer and to improve their lives. And we are doing everything we can to advance and press forward in service of that mission. And your advocacy is very, very helpful. I have seen senior staff at OPWDD have seen your letters, have seen your advocacy. It does have an impact. I think the fact that, as you saw today, that these questions have been raised to the highest level within the state is indicative of the impact that you do have. And so I am, I guess one thing would be, keep it up. And we are going to try to work as fast and well as we can to achieve some of the goals that you've articulated. And then I guess the other thing that I would say is if there are specifics in terms of either the reopening process when it comes to day services or visitation, anything that specifically you as a group would like to see, I would ask that, I don't know, the two moderators, if you could collect those into some way. It is obviously much easier for me to see a synthetic piece than it is to hundreds of individual pieces. And I guess the last thing is the There is the best way if you want individual emails. We do have an info@obwde.ny.gov. That's our commissioner's correspondence unit that actually comes in, and then there's a daily report out of each of the documents that any letters or so on. So that is really the best way.
I'm sorry, Roger. I did offer you the last word, but I just have to interject there that, not for nothing though, that info at email address has been completely useless to us. I think many of us have emailed that address countless times. We get nothing but the automated response saying, "Yep, we hear you. We hear your message, and we'll get back to you." And that's the end of that. So I'll go ahead and let you go on. I just had to jump in there for a moment. I should say too that I think you're heading there, hopefully, but if you're not, maybe I'll help you there. I would like, we will, Russ and I and the moderators of the group will, as Russ said, collate some specific, needs, input, suggestions, and so on, and address it to you. But we would hope that there'd be a better avenue or a path that we could send it from that info. You don't have to do it. Give us that info now. Jennifer or yourself can
Yeah, and Jennifer has a direct line to me as well, as our press person, and I'm certainly happy to get emails directly. The challenge is I get an email every 5 to 10 seconds in my inbox, so if it's not necessarily actually an effective way for me to get information, just because there's so much information overflow in my own inbox that I can't I can't necessarily say that's a more effective approach, is my point.
Yeah, that's understood. I just like I said, I would just like to have a direct line or through Jennifer or whatever. We can discuss that offline, but to have that available to us, because as we said earlier, or as you indicated, we are a large group, and we are hammering, and we're probably not going to stop. I have to warn you with the emails to all the email addresses that we have, including yours. But we also would like to have that avenue to address and to have those answered, instead of getting that auto reply that all of us have become so annoyed by, to be honest.
Understood. Well, I do appreciate it, and I should probably go to my 2:00 meeting now. It's about 2:14. Thank you so much.
Right. Well, thank you so much for your time, and thank you everybody for attending. And everybody have a great day. And we'll be posting this on the group in a little while. Thank you so much, everyone.